Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. So welcome to Well Woman Wednesday. Today we are going to be talking about a pretty sensitive subject, and that is herpes. So genital herpes is today's topic. This was a requested video, and so I'm excited to jump into this for you guys. Make sure you keep watching to learn more. All right, girl gang. So genital herpes is a very sensitive topic. I have found that a lot of my patients suffer from this and are just absolutely devastated when we have this diagnosis. And so I really wanted to kind of try to break this down for you, hopefully to reduce some of the stigma and to really talk about how herpes is spread from person to person, to kind of destroy some of the myths that are out there, and really just kind of give you a little bit more education and reassurance about this condition. So let's start with the prevalence. And so the prevalence of herpes simplex virus is about 3 million people in the US. So it's pretty common. It's a herpes simplex virus. There's type 1 and there's type 2. So with type 1, we used to always think about this particular disorder being above the belt. So we thought about type 1 as pretty much being cold sores that you can get around the mouth or even sometimes inside the mouth. Now we're starting to see herpes simplex virus type 1 even in the genital area. The same is true for herpes type 2. We used to think that it was only below the belt or in the genital area, but now sometimes we actually are diagnosing herpes type 2 in the mouth. So we have to think about this in terms of symptoms specifically. So the U.S. Preventive Task Force does not recommend routine screening for herpes simplex type 1 or 2 unless someone is actually having symptoms. So symptoms might be having sores around the mouth or in the genital area, having frequent recurrence of these sores. And these sores may be like blisters. Some people describe them as looking like hair bumps or ingrown hair. So if you notice that this is something that is recurring frequently, definitely something you want to mention to your healthcare provider, and you may want to request to be tested because these tests aren't automatically done. A lot of the ladies that I see think that they've been tested for all STDs when they come in for their routine well woman visit, but that is not the case unless you come in and say, hey, I've been having these sores that have been reoccurring in my vaginal area, or I noticed that there was a sore on my partner's genital area. You may not be tested. If you report these symptoms, though, you should be tested, and it sometimes is required that we speak up a little bit and ask for testing. I don't necessarily recommend that women without any symptoms or without any concern that their partner might be having symptoms get tested, because the blood test that we do for women who do not have an actual sore or bump in their vaginal area is a blood test that looks for antibodies. And so with COVID being around, we've all talked about looking for antibodies in the blood, and so people are pretty familiar with this terminology. But when we look for antibodies to herpes simplex virus, it is pretty likely that most people have been exposed to this, whether it's herpes simplex virus type 1 or herpes simplex virus type 2. Certainly type 1 is more common for folks to have been exposed to. And like we said, it usually produces a cold sore, but can certainly occur in your genital area. So how do you actually get herpes simplex virus type 1 or type 2, or HSV for short, because that's a lot, that's a big mouthful. So the first thing I want to say is you don't get it from sitting on toilet seats, you don't get it from using someone's towel, you don't get it from sleeping on bed sheets with someone who has it. This is really spread by saliva, vaginal or penile secretion, so moisture that's coming from the vagina or the penis, and then also from skin to skin contact. So that's saliva, secretions, and skin to skin contact. That's it, that's all. Okay, so we want to kind of get away from this thing of getting STDs from toilet seats. A sexually transmitted disease or a sexually transmitted infection is sexually transmitted. Okay, guys, so let's really kind of bring that point to light, because I think a lot of people are very confused about that. Now, with herpes type 1 or cold sores, certainly kissing someone who has a cold sore can spread it, because that's skin to skin contact. If you're tongue kissing and you swapping saliva, that also is a way that herpes can be spread. If you're doing oral sex and there are secretions from the penis or the vagina, that is a way that herpes can be spread orally. And certainly also to the genital area. So if someone has a cold sore and they're performing oral sex, then herpes can be transmitted. Okay, if you are having anal sex or vaginal sex, herpes can be transmitted that way. And even sometimes if your partner has a lesion that's not necessarily on their penis, but is in the genital area, like in the pubes somewhere, then that skin to skin contact can cause herpes to be transmitted as well. So let's be clear about that. Now, what to do if you think you have symptoms? The first thing I want to say is, ladies, please don't be in denial. If you notice that you are constantly having sores or bumps or itching or burning sensation that then leads to a sore or bump in your vaginal area, please talk about it. I see women all the time who actually have sores, bumps, or lesions in their vaginal area, but they don't mention it at all. Like, this is something you should keep a check on. And what I highly recommend is that you, every few months or so, do a self-check with a mirror. Look in your vaginal area, know what your vaginal area normally looks like, so that you can recognize when something is wrong. So let's say that you're someone who's constantly getting these bumps that are coming up, and sometimes they certainly can be razor bumps or ingrown hairs, but I think that if you're seeing them frequently, you should say something and we should do some testing. The reason why this is really particularly important for women of childbearing age is that herpes can be transmitted across the placenta to the baby. So you can actually give herpes to an unborn baby. Now, that is very rare, and usually that occurs when someone actually gets infected with herpes while they're pregnant. So when you get infected while you're pregnant and you have what's called a primary outbreak, that can certainly cross over to the baby. For women who have been infected prior to being pregnant, it's very rare that they're actually able to pass that to their baby, because they're having what's called a secondary outbreak. So a secondary outbreak is when you've already been infected, you have probably already had a recurrence of some bumps or sores or lesions in the vaginal area. And so this is just kind of like another small cluster, or maybe even one or two lesions, and that's considered a secondary outbreak. And so the primary outbreak is usually something that you will notice. So you may have fever, you may have just kind of a generalized, I don't feel good type of feeling that we call malaise. Some women develop like symptoms like body aches that might be similar to what you might get with the flu. So it's really important that when you see these things come up in the vaginal area, or even around the mouth area, that you speak up and say something, because there are testing that are available and there are also treatment that are available. We were talking about women of childbearing age, and the reason that I really try to drive this point home is that if you are positive for herpes virus type 1 or type 2, and you have seen an outbreak in your vaginal area, we should be testing for herpes type 1 and 2 so that we know whether or not you have been exposed to these viruses. So what we're testing is either a lesion that's in the genital area. We can use a Q-tip that we kind of rub over this lesion, and we collect what's called a culture. That's sent off, and it is a DNA test that we want to get. Or If you don't have a lesion, but you have noticed that they have been coming up regularly, you've been seeing sores, bumps, blisters, or having pain at certain spots in the vagina, then we can do a blood test. And that blood test looks for antibodies. When we find antibodies, we know that at some point you were exposed to the virus. Now, here's the downside of testing. When we test, we can't tell when you got it. We can't tell who might have given it to you. The only way to really know that is if you have previously tested negative and then you've had a partner and then you now test positive. Then we can kind of narrow that down. Some women may have been exposed to herpes but never knew it until they're actually tested. So it could be the first time you had sex, it could be the last time you had sex, or anywhere in between. And so it's very difficult to really determine when you actually got it unless you're having a primary outbreak and we see, a lot of usually bumps or blisters, a lot of vaginal pain and discharge during that primary outbreak. We may also see other symptoms like flu-like symptoms or even fever. And so a primary outbreak is easier to nail down in terms of timing of the exposure. But once you're in that secondary phase where you may only be having a few bumps coming up here or there, it is very difficult to know when you actually were infected. So that's kind of the downside. And I find that a lot of women really suffer mentally and emotionally after this diagnosis because they know that this is something that may show up so people can actually see it. Herpes is actually treatable. It is not curable, but it is treatable. You usually use an antiviral medication like acyclovir or valcyclovir or Valtrex, which is a really popular medication. And we only really need to use this treatment if you are having consistent outbreaks. So if you're having more than 2 or 3 outbreaks per year, then you may want to be on what's called suppression therapy, which is where you're taking acyclovir or valcyclovir every day. If you're not having frequent outbreaks, then you only need to be treated when you have an outbreak. And that usually entails, having the medication for about a week at a time when you have an actual outbreak, okay? So you don't necessarily need to be on suppression therapy unless A, you are having frequent outbreaks, more than 2 or 3 a year, or B, you're pregnant and in your late 3rd trimester. So we talked about how important it is for women of childbearing age to report any symptoms or to even report if their partner has been experiencing symptoms. If you're worried about fidelity, about whether or not your partner is skipping out on you, seeing someone else, it may also be a reason to request testing if you are pregnant. And that is just because we know that women who are pregnant have a higher likelihood of transmitting the virus to their baby. We talked about a primary outbreak being the usual way that happens, where herpes spreads from mom to baby. But the most common way that happens is if a mom has an actual outbreak. She has a sore in her vaginal area or inside her vagina or on the cervix where the baby is coming through the birth canal. So we don't want babies to be exposed to herpes while they're actually being birthed. And so if there is a lesion or a sore or a bump or a blister in the vaginal area, sometimes it is appropriate and safe to cover that with a special dressing. It looks kind of like saran wrap that helps keep the baby from having skin to skin contact with that lesion. But if that sore or bump or lesion is very close to where the baby has to pass through the birth canal, then we really need to consider doing a cesarean delivery, because the rate of transmission from mom to baby when the baby is coming through the birth canal can be as high as 60%. And herpes can really make babies sick. So while most women who have herpes or who have been exposed to herpes are going to be just fine with no problems, if a baby contracts it, it can really be life-threatening. So we want to be careful about making sure that we're talking to our providers. If we have a history, we need to report it. There ain't no shame in that. You need to talk about it so that you can get the appropriate therapy and make sure that your baby is safely born. So I want to just talk a little bit about that whole emotional, mental thing that I alluded to earlier. So, there's nothing wrong with you. There's nothing dirty about you. This is a sexually transmitted infection that is very common. And that's why you always hear me say, be picky about your partners and make sure you're having safer sex using condoms or skin barriers. And people always say, turn off the lights for sex. Sometimes you need to leave them lights on and really do a good physical check on your partner. I have had people actually call me up and say, I saw a bump in my partner's genital area. What should I do? And I said, don't have sex with them until that bump is gone, until they have had a test. So my real girl talk recommendations today is that you really pay close attention to your partner, that you examine and make sure you know what everything is looking like down there. And to do that, there has to be an element of trust there. And really, we should be picking our partners very carefully. And it should be people we could really talk to and be real with and ask questions of and expect to get a truthful answer. And that's just kind of my soapbox on this issue. But if you can't have a real conversation with your partner, you may want to consider not having sex with them. So, when I see ladies who have been exposed to herpes virus, I really explain to them that their health is really not necessarily at risk. This is something that we can treat. We may not be able to cure it, but we can certainly treat it. And it's something that can be well controlled. So, if that's you, if you've been exposed, or you just found out that you have herpes, don't despair, okay? This is something that we can take care of. So if you've been recently diagnosed with herpes, don't despair. This is something that we can treat. This is something that can be controlled. No, it can't be cured, but there are definitely some great treatments out there. And again, remember we said it's spread by saliva, secretions, and skin-to-skin contact. So if you have a lesion, this is certainly not the time that you want to be sexually active. You want to have a conversation with your partner, and there definitely needs to be some grace and some compassion involved in that conversation. I always tell my patients that the risk of transmission when you don't actually have a lesion or a sore is quite low, somewhere between 2 and 5% risk of transmission. When you have sex, when you do have an active outbreak of herpes, then that can certainly lead to transmission, because not only do you have secretions, but you have skin-to-skin contact. So I think it's really important to have some very honest conversations with your partner. I think it's important for partners to be treated. And if you are involved with a partner who has not been exposed to herpes, you may want to talk together about you getting on some suppression therapy just to protect your partner and to avoid frequent outbreaks. So I hope I shed a little bit of light on this topic today. And you can post questions or comments in the comment section below. Make sure you subscribe so you don't miss a single Delivering Joy MD TV episode. And I'll catch you on the next go round, girl gang. Peace.